This is Dr. Zorba Pastor with a rapid update that has some good news. There may be a blood test that may help you predict whether or not you might get Alzheimer's. Notice there are a lot of mays in there. So let me tell you a bit about this. So first of all, dementia comes in many flavors. Small strokes, Parkinsonism, trauma from the brain, boxing, football, a lot of ways to make your brain go downhill. But the most common form is Alzheimer's disease. My mom died from it. My wife, Penny, of 50 years, had cognitive decline, and Alzheimer's may have been part of that, but she had multiple other factors that may have figured out here. So for many years, they've been looking at a possible blood test called p-tau 217, p-tau, Tau-217 in the asthma. And this particular protein appears to be something that is involved in something called amyloid distribution within the brain. Amyloid protein in the brain seems to cause the plaques and tangles of Alzheimer's in the brain where the signals don't work right. And so they've been following this for a number of years. And if this particular test could predict the outcome, that might be a good thing to do. So they looked at about 2,500 patients from several different studies because they've been looking at this protein from several different studies for years. And by the way, it's very difficult to measure something like this because Alzheimer's and other forms of dementia actually take years to whether or not they're actually going to happen. So they followed about 2,500 patients for 13 and a half years, looking at 6 studies around the country. Everyone was cognitively fine at the beginning of the study. Just like you and me, your brain is working properly. Some had very elevated p-tau 217, and some had minimally or no elevation of p-tau 217, and they compared them. The ones who had high amounts of p-tau 217 had a 38% higher risk of developing dementia. The higher the p-tau 217, the greater the risk of developing dementia. Okay, it's only one study, but it dovetails on other research out of Mayo Clinic, the Mayo Clinic study of aging that shows that p-tau 217 might be predictive of this. Now, right now, the clinical guidelines from the Alzheimer's Association and basically almost all other medical groups explicitly recommend against testing cognitively normal patients doing this outside of research studies. I'm not exactly sure why, but probably because of the false positive. In other words, it may say you're going to develop Alzheimer's and you actually don't. In other words, that's the fear. On the other hand, if you knew that there was a possibility that you were had a greater risk for dementia, you might change your lifestyle. What would that be? Well, first of all, the same risk reduction actions that we take for heart disease and stroke, keeping your blood pressure under control, eating a more Mediterranean diet, exercising every day, losing weight, all those things to keep your heart healthy actually decrease the risk of dementia from cardiovascular disease. We know that. In other words, small stroke dementia is decreased when you do those things. And possibly, because we don't know, we're not exactly sure, it may reduce the risk of Alzheimer's disease. We know the best diet you can have is the Mediterranean diet. So if you knew you had a risk for dementia, you might go on the med diet. And finally, you might stop all alcohol, except on certain occasions like a wedding or a bar mitzvah or when the Packers win the Super Bowl. You're going to have a drink then, but you might stop having a drink every night because we know that alcohol can affect dementia in one way or another in larger amounts, but we don't know with people at risk if it actually affects them in smaller amounts. Now, I don't recommend you sit, if you had a positive test, in a dark room and worry about the possibility of losing your mind. But you might decide to do the things that you wouldn't do while you can love and enjoy it. And that's why I think that at some time, this test in the future is going to be available. And then people should be given the possibility of taking the test. And then you, my people, on my podcast can decide whether or not you want to take the p-tau test. This is Dr. Zorba Pastor saying stay well.